Hi everyone, it's Lenore, the Medicare lady, and this is 7 questions you need to ask before going on Medicare. Question 5 is, what's the difference between a Medicare supplement plan, also called Medigap, and a Medicare Advantage plan? Now, our last question talked about the cost of Medicare, and we know that no matter what you do, you're enrolling in Medicare Parts A and B, but you don't have complete coverage. There's no cap on the out-of-pocket expenses with Medicare. Medicare is covering about 80%, you're paying about 20%. And if you have a major health issue like cancer, heart attack, stroke, joint replacement, you'll pay 20% of your out-of-pocket costs with original Medicare. So a $100,000 open heart surgery, for instance, would cost you about $20,000. You need to figure out how you're going to cap your expenses, and there are 2 ways. You're going to cap your expenses by enrolling in a Medigap supplement plan with a drug plan or a Medicare Advantage plan. Now, either way will work. They'll help you cap your expenses, but one way might be better than another for you personally. So this is a chart showing you the top points of what's different about Medigap supplement versus Medicare Advantage. The first thing that's different is the cost. A Medigap supplement plan has a monthly premium. This premium can vary based on your age, where you live, whether you're a man or a woman, and it goes up every year. So it can vary. It can cost anywhere from like $65 a month to $200 a month. You'll pay that on top of a Medicare Part B premium, but generally you'll have no copays and very low out-of-pocket expenses with a plan like this. So if you had that $100,000 open heart surgery, your out-of-pockets could be as little as $198 and all your other stuff is paid. So a Medigap supplement plan, yeah, you're paying this monthly premium, but you really don't have any other costs as you go along. Medicare Advantage plans, very similar to a group health plan. They're HMOs, they're PPOs. Typically, there's no premium for the Advantage plan. You still pay your Part B premium, whatever that is, $144.60 a month or higher. You may have copays, deductibles, and just various out-of-pocket expenses, which are capped at $6,700 to $10,000 in a plan year. Okay, those are the numbers for 2020. So if you had an open heart surgery, $100,000 surgery, you'd pay as you go. The cost would be capped at $6,700 to $10,000. So that's what you'll likely pay if you had a major surgery like that. The next big item about difference between Medigap supplement and Medicare Advantage is the enrollment part. When you turn 65, you become eligible for Medicare. When you come off an employer group health plan, you may enroll in Medicare. This is the best time to pick up a Medigap supplement plan, no questions asked. You can pick any plan you want and your acceptance is guaranteed. After that, they may not accept you. You have basically a 6-month window to choose which plan you want. After that, you have to answer health questions and they could turn you down for a Medigap supplement plan. Medicare Advantage, on the other hand, when you first turn 65, you can enroll in the plan, and every year you can change your Medicare Advantage plan to a different Medicare Advantage plan once a year during what's known as AEP. So you can go from Medicare Advantage to Medicare Advantage. Okay? As far as doctors, hospitals, referrals, and networks, with Medigap supplement, 90% of doctors and hospitals take Medicare, so you don't have to worry about referrals. You can use any doctor in the whole United States. It's a federal program, big advantage to a Medigap supplement, so it gives you freedom of choice. Medicare Advantage, on the other hand, you may have to use providers in the network, usually with an HMO. You must use those providers. Networks are usually geographic based on where you live. So if you live on a state border, for instance, you may not be able to go to a different state to get services. Keep that in mind. If you have a PPO plan, you can use out-of-network services, but your costs are typically higher. Medicare Advantage plans also may require referrals or pre-approval authorization for certain services, where you're not likely to see those with the Medigap supplement plan. And then finally, the next big difference between the two is that with a Medigap supplement plan, prescription drugs are not included. Extras like vision Dental and hearing not included, whereas with Medicare Advantage, they typically bundle your drugs and some of those extras like 2 dental cleanings, a pair of eyeglasses every year into the plan. So big difference. A lot of what you see on TV is Medicare Advantage. Basically, they're telling you that you can get more than Medicare. What they're talking about is original Medicare. So there is a difference between the two. Basically, Medigap supplement allows you to use any doctor hospital you want. Very little out-of-pocket expenses, capped at maybe under $200 a year. What you're paying out of your pocket could be a good thing. But it doesn't include the drugs or some of those nice extras. And you do have to select this when you first enroll, otherwise you could be locked out of it. Medicare Advantage, on the other hand, is more flexible in that every year you can change your plan, doesn't have a monthly premium, may include some extras like vision, dental, will likely include your drugs. But if you have some major health issues, you must use doctors, providers in the network, and your out-of-pocket costs could be significant, as high as $10,000. So that's the main differences. If you have questions, you definitely need to give us a call on this. Thanks so much.